Some friends of ours had told us to get a second opinion from Mott.
Sat down and talked to us and, answered all the questions that we had.
All the doctors and the care team, it's just an amazing place to be.
It was so scary and terrible, but at the same time, I felt like I was in good hands.
I have this unique connection and empathy with patients because I can tell them that I've literally been in their shoes before.
Hello and welcome to Miracles from Mott, Michigan Answers for Kids. I'm Tati Amara. Today is certainly a day to be thankful for many things, especially the University of Michigan Health C.S. Mott Children's Hospital. Every day, teams of dedicated people are changing children's lives in extraordinary ways. From advanced technologies to breakthrough treatments to leading-edge surgeries, the leaders and best at Mott Children's Hospital provide comprehensive, specialized health care for children every day. In the next half hour, we are going to introduce you to some special families who directly benefit from this pediatric expertise. We'll also talk to some of those specialists who are truly making a difference. We're fortunate to have one of the nation's best children's hospitals recognized by U.S. News and World Report year after year right here in Michigan. Of course, none of the extraordinary work done at C.S. Mott Children's Hospital can be made possible without help from donors like you. As a not-for-profit organization, they depend on generous gifts from their supporters. So today we are asking for your donation by simply scanning the QR code you see on your screen. We hope these stories we share with you will inspire you as much as they have inspired us. To start things off, I'd like to introduce you to Cruz Rodriguez. Even before birth, Cruz was dealing with a very complex heart defect, which basically left him with half a heart. While other medical professionals gave up on him, a second opinion from the team at C.S. Mott Children's Hospital offered the Rodriguez family hope and a solution that literally saved their son's life.
We met with the fetal medicine doctor. She said the defect was so complex and the required surgeries that many parents at this point would just consider terminating the pregnancy.
And I was just like, wow.
I don't think we were ready to receive that kind of information at all.
Some friends of ours had told us to get a second opinion from Mott, and that's what we did.
We set up an appointment.
They talked to us, they explained everything.
Dr. Oye sat down and talked to us, and I thought, here's this busy surgeon that's, saving lives every day. And he sat down and talked to us and, answered all the questions that we had.
He was getting into detail, and he never ever mentioned aborting.
At the end of the conversation, we said, well, this fetal medicine doctor had her first suggestion was to terminate our pregnancy, and you haven't said that at all.
And I said, you haven't even mentioned that. And he was like, why would I mention that?
And he kind of just looked puzzled and said, well, I don't know why you would do that because we can fix this.
Some of the really complex heart defects, like Cruz's, were not so universally accepted as treatable.
This is something that, many years ago, babies wouldn't even survive.
You can think of it as having half a heart.
The right side of his heart never developed.
So through a series of surgical repairs, Dr. Oye rerouted blood to create a single ventricle pathway.
It's a way that you can get by with only one pumping chamber instead of the two.
So we just kind of took it step by step and, led by U of M, really by first telling us that they could save, our child who we wanted desperately. And sorry.
He was born on a Monday. He had the first surgery that Friday.
Dr. Oye, Dr. Richard Oye.
He's like our savior, but he's my family's hero. And I don't just say that, he is.
He saved me. I wouldn't be here if it wasn't for that guy. I think he's awesome.
I have worked with Cruz since he was a baby alongside Dr. Pfeiffer.
And I have taken care of Cruz since before he was born.
They've always taken such special care. I feel like they're his only patient.
When he was born, we were just starting to appreciate how important it was for kids to stay active.
Once upon a time, we used to say just let them limit their own activities, they'll take their own breaks and a little more restricted. And now we're kind of like, do it.
It's been amazing. Him coming in and saying, I'm playing baseball, flag football, basketball, and just listing off the sports.
When Cruz's mom and Cruz came into clinic 2 years ago, and they're like, we're going to the Little League World Series. And I was like, oh, you're what?
And that's just what makes us smile inside, because we know that when he continues with that, that's only going to help his heart throughout his life.
We just want the kids to be normal kids. It can't always make the heart completely normal. We want to make their lives completely normal.
But when I'm on the field, I don't even think about it. I just feel like a normal kid.
I don't look at him like I look at him like there's my son getting a triple.
He's just the same as all of his friends in their standard issued hearts.
He's just a lead by example kind of guy, and he comes in and works his butt off. He loves to be around the game. He's the definition of a grinder, and he pushes guys just by his demeanor and how he comes in and competes.
My goal is for everyone to get better. Success is just getting better every day.
Over the years, there will be more and more medications and treatments and possibilities.
Through research that things like Save a Heart support, we're able to continue to advance medicine.
And we've seen this happen even over, Cruz's life.
When we talk about things or we experiment with things or we invent things, it affects not only the kids at our program, but kids across the world. That's why things like Save a Heart are so important to push the whole field forward for all the kids all over the world, not just at Michigan.
I can't even begin to describe how amazing it is to see them grow up.
So it's really a cool thing.
This is why we do it.
Mott Children's Hospital is based on the Michigan Medicine campus in Ann Arbor, and we see neonatal intensive care unit babies. We have pediatric cancer, pediatric orthopedics, pediatric surgery, any pediatric specialty that a child may need, we have in this hospital. We focus every single day on innovation, on making sure we have the best outcomes for children. We partner with other children's hospitals across the country to make sure our outcomes and our protocols are the best that they can be, so our kids have the best chance at living happy lives and having the best treatments available right here in the state of Michigan.
I'm Dr. Nina Marupudi, and I'm an associate professor of neurosurgery. I have wanted to work at the University of Michigan since probably when I was a baby medical student coming up the ranks. And part of it is there's school spirit, and there is this passion amongst the providers, the caregivers, the nurses.
We know that emotional support for children and families in their time of need is just as important as the clinical care. So we have very unique spaces throughout the hospital. We have our newly renovated Michigan Game Day Experience Room, which is actually an indoor playground. It's space for kids to be able to play video games. There's a jungle gym. There's a wheelchair accessible swing for kids in wheelchairs who want to feel the motion of a swing. We also have something like Sophie's Place. And what Sophie's Place is a music studio for kids to play instruments, to have music therapy, to make videos, to make music. And we can pipe a lot of the videos and the music into the patient rooms throughout the hospital. We also just launched our Mott Golf Classic Park, which is right outside the hospital. It's outside space for families, physicians, nurses, staff to gather, just to sort of step away from the hospital at those times when you need it. It's just a really special environment for families and kids.
My name is Jennifer Blaze, and I am a pediatric hematologist oncologist. Mott, one, it has such advanced medical care and really is offering the best for our kids, the best pediatric hematology and oncology in the state of Michigan. It also just is really patient-centered, and I feel like there's a huge holistic approach to patients, not just the actual chemotherapy they're getting or treatment they're getting, but also all of the supportive care that Mott has. And I'm glad that we're at a place that values all of that supportive care.
CS Mott Children's Hospital has a wonderful partnership with one of our sister hospitals, University of Michigan Health Sparrow. And there has been a pediatric joint venture for many, many years. But once Sparrow became part of the University of Michigan Health family, we've had the opportunity to enhance pediatrics in Lansing. And what that means is our physicians from Ann Arbor go to Lansing, and so there's continuity of care. We're using the same protocols. We are sharing best practice, and we're enhancing the services in Lansing in general. We also have an amazing joint venture with our partners at Trinity Health Oakland. And again, we have our physicians and our teams from Ann Arbor that staff clinics that are neonatal intensive care unit at Trinity Health Oakland, and an inpatient unit. We have infusion. And what that does is really just creates amazing access for families in Oakland, Wayne, Macomb County. And I know, speaking as a mom, how important that is to have care close to home. We just had a clap out a few weeks ago for a child who had their infusion therapy at Trinity Health Oakland.
The team here, the specific oncology care for osteosarcomas, was one of the more important factors that helped us make our decision to switch to U of M. They have a specific board of experts that focus specifically on osteosarcomas.
I am so proud to lead this hospital every single day, and it is the people that I see when I walk in. It is the community that we serve. I can't tell you how proud I am when I am outside of this hospital, when I'm in the grocery store, when I'm wearing this jacket and someone says, "Do you work there? You saved my child's life." And it is because of the excellent teams in this building who have made this their life's work. And I'm just so lucky that I get to be here.
Sometimes my brain has hiccups, is how Evelyn would explain her epilepsy to her kindergarten class. Since birth, Evelyn experienced episodes that could not be explained even with an EEG. It was only years later that Evelyn and her family found answers at CS Mott Children's Hospital.
I was about 4 months old when there were several of them in a row happening. She would randomly have moments where her eyes would start fluttering, and she would also look to one side. I feel like it was usually to the left or to the right. And every time I would try and get my phone to capture it, it'd be done and over with. And there was no pattern of what would be happening and why. She got hooked up to an EEG, and they sent us up for observation, but the EEG didn't pick anything up. She also has a rare genetic disorder of neurofibromatosis, so we didn't know if that was related. Things kind of slowed down, and then things would pick up about when she was a toddler, and it was only happening in the nighttime. And it would be like she was startling, and doctors thought maybe it was a sleep issue. We still felt like that something's not right. This isn't right. It's got to be more. So we also started seeing it happen during the day, and during the day when it was happening, she'd be reaching up with one of her hands, like she was trying to ask for help. And if you were looking at her face would be flushed, and her eyes were watery and bright, and she'd just make weird noises like she was hurt.
Like the noises were like and like when my eyes were watery, it looked like it looked like I was sad, like super sad.
We were able to order another EEG, and that's when they could see that there was seizures happening in the brain. Immediately, they started her on medicine, and she responded right away, which was so great. And then like a week or two later, they started coming back again, and it was happening more and more frequently, and we would up the dosage and hope for the best, and that still wasn't working. And then one weekend, we were up to 70 seizures within a weekend, and we learned she has a very rare genetic condition as well, DEPC5, and it causes seizures, but it also makes the body resistant to medicines, which is why all these medications that they were trying on her, her little body wasn't responding to.
What we learned was that she was having seizures from a part of her brain called the insula. And this is a very deep structure within the brain that has almost like a finger-like appearance. So it's not easy to do surgery on, it's not easy to access, and there's a long trajectory, a long pathway to get to that area. So we have to think really carefully and cautiously about how to treat this area.
She was taught that her brain sometimes had hiccups, and when she went back to her kindergarten class after the original diagnosis, she would say, "Sometimes my brain has hiccups and I might reach for you to help me."
What we wanted to do was offer Evelyn an opportunity where she didn't have to have open surgery, but in a less invasive, minimally invasive fashion, be able to place a fiber that was going to be able to treat her seizure focus. The procedure is called laser interstitial thermal ablation therapy, or we call it LIT for short. It is technology that uses light and heat in order to ablate or to cauterize tissue. There's also a concern that in Evelyn's case particularly, where the seizures were coming from, they were so far posterior in this structure that there are pathways that can affect her motor function in that area too. We did a portion of the procedure first in order to ensure that she didn't have any injury to these motor pathways. And then later on, when she had recurrence of the seizures and there was some healing that had already happened, we brought her back to complete the procedure and remove the rest of the insula with the laser ablation technique.
We found a good team here at Mott's, and they were able to work with us, and it was scary, but it was good because of the care that we got here.
What's really wonderful is her cognition, her ability to learn, her ability to just be happy and not be worried about when she's going to have her next seizure.
She had the other round of ablation surgery just over a year ago, and we finally made 1 year seizure-free.
The longer we get from the time that she had her last seizure, the better the chances are for a lifetime of seizure freedom.
What are the odds that two boys from a small town in Michigan who attended the same high school would end up with the same cancer diagnosis just a week apart? Pretty rare. But that is what happened to DJ and Landon. Having a friend who is going through the exact same challenge can make all the difference in the world. And that's why DJ and Landon have such a special bond that will last a lifetime.
Last year at this time, I went from a mom of two healthy kids to being thrust into a world that nobody ever imagines.
DJ was very active in football and basketball and golf. He was just very active. And last year he was a sophomore at high school and he was just starting to bud in all of these sports.
The morning of Tuesday, the week before Thanksgiving, he woke up and had pain around 5 a.m. in the morning. He had been playing basketball 5 days a week, so I thought we were dealing with a sports injury, or maybe a rolled ankle, something. You know, he's a typical teenage boy. They mess around.
Over a year ago summer, he joined the summer basketball league through high school, and he started complaining of some knee pains, right knee pain. And we're like, well, you probably have a sports injury. You're playing basketball. You've been nonstop playing sports since the beginning of the school year. We'll keep our eye on it and see what happens.
I knew something was off because nothing really happened. I had one little tumble, but I didn't think it was that bad to have this much of pain.
So we were referred to Dr. Caird here, who is an orthopedic surgeon. We came in for that appointment and she sat down with us and just said, have you looked at the imaging? And we said, No. So she slid it over to us, and I mean, it was obvious. He was diagnosed with high-grade osteosarcoma.
We got an MRI that week. The way it looked, it was completely encompassed in his tibia, but because it crossed the growth plate, it was slightly concerning and said that they needed a biopsy. It came back osteosarcoma.
Because of the location, we were dealing with the tumor being wrapped and encompassing his Achilles tendon, so they felt the best course of action would be to take the limb.
DJ was offered 3 treatments initially. He opted for the limb salvage surgery with the cadaver bone and the muscle flap and knee replacement.
When we first got diagnosed, the parents of some of the basketball players on Landon's team were telling us that there's another family in the school district who just received the same news. And we were floored. How is that possible? With osteosarcoma, you don't hear it very often. It's pretty rare. So for it to be in a very, very small community school was very shocking to us.
The community is great. The school is great. They really stood behind those boys. It shocked everyone. Like, that's crazy.
They had a fundraising event at one of the basketball games in honor of both of the boys. DJ was there, so we were able to meet DJ.
So the first, I'm going to say 2 months, we were just really asking each other, like, what'd you do for this and what'd you do for that? And
yeah, feeding off of one another.
Or I'm giving her updates because Landon was a week behind DJ in treatment. So I'd give Lori updates. Okay, 7 days after this is what DJ's feeling like. So you can expect Landon to feel that way.
Side effects.
Yeah, it was crazy.
At first I was pretty scared, but I feel like when you get to know the people here, like your nurses people, makes everything better than it seems.
There's a lot of, like Landon said, there's a lot of people that once you get to know them, they're like really close and just helps a lot. Sophie's place was like my go-to basically. The music therapist there, Matt, was very helpful. I would always go down there every single week I had treatment and play with him as much as I could.
I don't play an instrument, but every time he wanted to go, I was like, I need to do something.
Yeah, it was good therapy to get him out of the room. Whatever DJ did, Landon kind of followed suit. So whether it was going to Sophie's place or going out to the courtyard to just enjoy the sunshine. And I think just doing it together brought so much joy to them. Takes your mind off of, all the bad that's happening.
The doctors, they know. They're not in their room, they're out somewhere. Oh, you're in the hallway. They'll do rounds in the hallway with both boys.
Yeah, and I think for them, just to see a familiar face was so comforting. They got to know their nurses very well. They had primary nurses. Each one of them had different primary nurses who were kind of tailored and custom to what they enjoyed. And they really formed a bond with these nurses.
Still learning how to swing and stuff again, but golf, I'm going to try to be a good golfer again.
Hoping to eventually play basketball again.
It's been a wild ride, but we have had the best support in all forms. Inside this hospital, in our own community, in our families, everywhere. It's been amazing.
At 8 years old, Tommy received a heart transplant at CS Mott Children's Hospital. Little did he know that many years later he would end up back on the same floor he was actually treated on. Only this time as a nurse. It was truly a full circle moment for Tommy.
What people call, or even I call, tough, dark times in my life, I'm able to call them blessings in a weird way. I wanted to become a nurse because of my experience as a patient. I'm gonna be on the floor. I was once a patient. Like, how cool could that be? I was born with a hypoplastic left heart syndrome, which is just like a congenital heart defect. So I had my first open heart surgery when I was 8 days old, and I had 5 open heart surgeries by the time I was 5. That worked pretty good for a little while, and then my heart went into failure, and they said there was nothing else they could do for me surgically, so my only chance of survival was a transplant. On June 3rd, 2009, I was blessed with a call that they said they had a heart for me, and so I received my heart transplant on that day at 8 years old.
Yeah, I think about them a lot, almost every day, especially, she's just someone I'm hoping I'm making proud with what she's given me.
I lived a pretty great life, pretty normal life you could say, for about 10 years. And then in 2019, shortly after my high school graduation, I started getting these bad headaches that turned into like really bad body aches. And I found out it was like a form of post-transplant leukemia. And so then I was admitted here on the oncology unit for about 6 months of intense chemotherapy treatment. It's just recently put on the survivors list for a cancer survivor at the 5-year mark. Finding a career path that fit me for a long time, like I couldn't figure it out, which is crazy for me to say because I've been in the hospital throughout my entire life. Why else would I be anywhere else? And I realized that the best way to do that was to go into the field myself and be a nurse because, just to be able to give back to other patients all the helpful and amazing lessons and things and comfort and care that I've been given here by the nurses and team here at Mott. I thought what better way to give that back than to go into that myself.
I've bonded with him since he was teeny tiny, and we've shared a lot of great memories. It makes my heart so happy. I knew that Tommy was going to be somebody special since he was this big, and now to be able to work with him, it's like incredible.
I think it's kind of cool. I mean, he was around us all the time, so I'm glad we had such a positive effect on him.
They've been great coworkers, just as they have been nurses for me when I was a patient. That's the kind of nurse that I'm hoping to be, just having that ability to uniquely connect with patients in ways that, that a textbook can't teach you in nursing school, that nobody can teach you unless you've gone through what they're going through yourself. I've loved, every second I've been working here.
I've talked to some parents who have met Tommy and had him as their tech, and they have had nothing but wonderful things to say, and they feel like it's really special to have somebody who understands where they're coming from and can relate with their children. Not everybody has those scars.
So just seeing somebody who's grown up and has been successful and is living just great, it's very encouraging to see that for sure as a parent.
Finally able to find where I'm supposed to be makes my heart jump. It makes me smile. It, just brings me comfort, and just seeing the hope in those patient and families' eyes that I know other nurses have given me and my family is just, again, feels full circle, and it just feels, it feels like I'm right where I'm supposed to be.
Thank you so much for joining us today. We want to extend a big hail to all the little victors and their families who graciously shared their stories with us, and to our community for your generous support of the life-changing work the teams at Mott are doing every single day. Thank you on behalf of CS Mott Children's Hospital and all of us here at WDIV Click on Detroit. Happy Thanksgiving.